5 health checkups you should avoid after 70 that may harm you more than help as people cross the age of 70. The focus of healthcare should gradually shift from aggressive disease detection to preserving quality of life, independence, and overall well-being. While regular medical care remains essential, not every health checkup that is useful in younger adults continues to provide the same benefit in later years. In fact, some routine screenings can lead to overdiagnosis, unnecessary anxiety, invasive procedures, and treatments that may cause more harm than good. Aging bodies often show changes that are natural rather than dangerous. Yet modern tests are so sensitive that they can label these normal variations as medical problems. This can result in repeated testing, hospital visits, medication side effects, and a reduced sense of comfort and confidence in daily life. For older adults, the true value of any health checkup lies in whether it meaningfully improves life expectancy or quality of living. Tests that take many years to show benefits, or that carry significant risks, may no longer be appropriate for everyone after 70. Instead, healthcare decisions should be personalized, taking into account overall health, existing medical conditions, life expectancy, and individual preferences. Understanding which screenings to reconsider can help seniors avoid unnecessary medical interventions and focus on care that truly supports healthy, active, and dignified aging. Number 1. Routine PSA test after age 70. Routine PSA, prostate-specific antigen, testing after the age of 70 is increasingly considered unnecessary and potentially harmful for many older men, especially those without urinary symptoms or a strong family history of aggressive prostate cancer. PSA is a blood test that measures a protein produced by the prostate, but elevated PSA levels do not automatically mean cancer. They can also rise due to benign prostate enlargement, inflammation, infections, or even recent medical procedures. After 70, the likelihood of detecting slow-growing, low-risk prostate cancers increases significantly, and these cancers often never cause symptoms or shorten life expectancy. However, once an elevated PSA is found, it frequently triggers a cascade of further testing, including repeat blood tests, biopsies, and imaging, which carry their own risks. Prostate biopsies can lead to pain, bleeding, infections, and hospitalizations, risks that are higher in older adults due to weaker immunity and other existing health conditions. Even more concerning is overdiagnosis, where cancers that would never become life-threatening are discovered and labeled as a disease, causing psychological stress and fear. Many men then undergo aggressive treatments such as surgery, radiation, or hormone therapy, which can result in long-term side effects including urinary incontinence, erectile dysfunction, bowel problems, fatigue, and reduced quality of life. Studies have shown that for most men over 70, especially those with other chronic illnesses like heart disease or diabetes, routine PSA screening does not significantly reduce prostate cancer mortality. This is because prostate cancer typically grows very slowly, and it can take 10 to 15 years for screening benefits to appear, time that many older adults may not have or may prefer to spend maintaining comfort and independence rather than undergoing medical interventions. Additionally, false positive PSA results are common, leading to repeated testing and ongoing anxiety even when no dangerous cancer is present. Modern medical guidelines therefore recommend that PSA testing after 70 should not be done routinely, but should instead be based on individual factors such as overall health, life expectancy, personal values, and the presence of symptoms like difficulty urinating, blood in urine, or persistent pelvic pain. In many cases, a strategy of watchful waiting or symptom-based evaluation is safer and more appropriate than routine screening. Ultimately, the goal of healthcare in older age is not simply to find every possible abnormality, but to preserve quality of life, reduce unnecessary medical burden, and avoid treatments that may cause more harm than benefit, making routine PSA testing after 70 tests that should be carefully reconsidered rather than automatically performed. Number 2. Routine mammogram after age 70. Routine mammography after the age of 70 is often reconsidered because the balance between benefit and harm changes significantly in later life. While mammograms are effective for early detection of breast cancer in younger and middle-aged women, their usefulness declines with advancing age, particularly for women who have no symptoms and no strong family history of breast cancer. As women grow older, many breast cancers tend to be slow-growing and may never become life-threatening during their remaining years. However, routine screening can still detect these low-risk tumors, leading to overdiagnosis, the identification of cancers that would never have caused illness or death. Once a suspicious finding appears on a mammogram, it usually sets off a chain of further tests such as repeat imaging, ultrasounds, biopsies, and sometimes surgery. These procedures can be physically stressful and emotionally draining for older women, increasing anxiety, fear, and discomfort. Biopsies and surgical treatments also carry higher risks in older age, including poor wound healing, infections, bleeding, and complications from anesthesia, especially for those with other health conditions like heart disease, diabetes, or lung problems. Another important factor is that the survival benefit from routine mammography often takes many years to become evident, typically 7 to 10 years or more. For many women over 70, especially those with limited life expectancy due to other medical issues, this delayed benefit may never be realized, while the harms of screening are immediate. False positive results are also more common with age, meaning women may be told they might have cancer when they do not, causing unnecessary worry and repeated testing. Additionally, treatment of detected cancers may involve radiation therapy or long-term medications, which can worsen fatigue, weaken bones, or interfere with daily functioning. Because of these concerns, many medical guidelines suggest that routine mammograms after 70 to 75 should not be automatic, but instead be based on individual health status, life expectancy, and personal preference. For women in excellent health with a strong family history or genetic risk, continued screening may still be reasonable. However, for many older women, focusing on symptom-based care, such as promptly evaluating new breast lumps, skin changes, or nipple discharge, offers a safer and more balanced approach. Ultimately, the goal after 70 is to prioritize quality of life, minimize unnecessary medical interventions, and ensure that any screening test performed has a clear and meaningful benefit, making routine mammography a decision that should be carefully individualized rather than routinely continued. Number 3, colonoscopy after age 70. Routine colonoscopy after the age of 70 is often questioned because the potential risks of the procedure begin to outweigh its benefits for many older adults. Colonoscopy is an invasive test that requires bowel preparation, sedation or anesthesia, and the insertion of a flexible tube through the colon to detect polyps or cancer. While it is an effective screening tool in younger populations, its value decreases with age because colorectal cancers typically develop very slowly, often taking 10 to 15 years to progress from a small polyp to an advanced cancer. This long timeline means that many adults over 70, especially those with other chronic health conditions, may not live long enough to benefit from the early detection offered by routine screening. At the same time, the risks associated with colonoscopy increase significantly in older individuals. Complications such as bowel perforation, bleeding, dehydration from bowel preparation, and adverse reactions to sedation are more common in this age group. Older adults are also more vulnerable to electrolyte imbalances, dizziness, and falls during the preparation process, which can be physically exhausting and dangerous. If a polyp is removed, the risk of bleeding is higher, and recovery may be slower due to reduced healing capacity and the presence of other medical conditions. False positive findings or detection of harmless polyps can lead to repeated procedures and ongoing surveillance, further increasing physical and emotional burden. Additionally, hospitalization due to complications can result in loss of independence, confusion, or functional decline, particularly in frail seniors. For these reasons, many medical guidelines recommend stopping routine colonoscopy screening between the ages of 70 and 75, especially for individuals who have had previous normal screenings. In some cases, less invasive alternatives, such as stool-based tests, may be considered if screening is still desired. However, a symptom-based approach, promptly evaluating warning signs like unexplained weight loss, persistent abdominal pain, blood in the stool, or changes in bowel habits is often more appropriate. After 70, healthcare priorities should focus on maintaining comfort, independence, and overall quality of life, rather than subjecting individuals to invasive tests that may offer little benefit while exposing them to significant risks. Number 4, full-body CT or MRI scans. After age 70, routine full-body CT or MRI scans are often promoted as advanced preventive health checkups, but after the age of 70, they can create more harm than benefit for most people. These scans are highly sensitive and can detect even the smallest abnormalities throughout the body. However, many of these findings are incidental and clinically insignificant, especially in older adults. As the body ages, it naturally develops benign cysts, nodules, calcifications, and age-related changes that are not dangerous and do not require treatment. When a full body scan detects such findings, it frequently triggers a cascade of follow-up tests, specialist visits, repeat imaging, and sometimes invasive procedures such as biopsies or surgeries, all of which can cause physical stress, anxiety, and unnecessary medical costs. One of the major concerns with CT scans is radiation exposure. Although a single scan may seem harmless, full-body CT imaging exposes the patient to a relatively high dose of radiation, which can slightly increase the risk of cancer over time, a risk that offers no clear benefit when the scan is done without symptoms. MRI scans do not involve radiation, but they are lengthy, expensive, and often require contrast agents, which can pose risks to older adults, particularly those with kidney problems. Another issue is overdiagnosis, where harmless conditions are labeled as diseases simply because technology can detect them. This can lead to overtreatment, including medications or procedures that may worsen quality of life rather than improve it. For seniors, the psychological burden is also significant. Being told that something abnormal was found can create fear and ongoing worry, even when the finding is unlikely to ever cause harm. Importantly, there is no strong scientific evidence showing that routine full-body scans in symptom-free older adults improve survival or overall health outcomes. Most serious conditions in later life are better detected through regular clinical checkups, targeted tests, and attention to symptoms rather than broad, unfocused imaging. Medical guidelines therefore discourage the use of full-body CT or MRI scans as routine screening tools after 70 and recommend that imaging be done only when there is a clear medical reason, such as persistent pain, unexplained weight loss, or abnormal lab results. After 70, healthcare decisions should emphasize thoughtful, symptom-based evaluation and avoidance of unnecessary tests that may lead to stress, complications, and reduced quality of life. Number 5, aggressive bone density testing leading to overtreatment after age 70. Bone density testing, commonly done using a DEXA scan, can be useful for assessing fracture risk in older adults, but after the age of 70, aggressive testing followed by automatic treatment can sometimes cause more harm than benefit. As people age, some degree of bone loss is natural, and not all reductions in bone density translate into a high risk of fractures. However, when mild or borderline bone loss is labeled as a disease, it often leads to long-term prescription of osteoporosis medications without fully considering the individual's overall health, mobility, nutrition, fall risk, and life expectancy. Many of these medications, especially when taken for years, are associated with significant side effects, including digestive irritation, muscle and joint pain, low calcium levels, and rare but serious complications such as osteonecrosis of the jaw and atypical femur fractures. These risks are particularly relevant in older adults who may already be dealing with dental issues, kidney problems, or multiple medications. Another concern is that repeated bone density testing can create unnecessary anxiety, making individuals feel fragile or fearful of normal movement, which can actually reduce physical activity and increase fall risk. Over-reliance on scan results may also distract from more effective and safer interventions, such as improving balance, strength, and mobility through exercise, ensuring adequate intake of calcium and vitamin D, addressing vision or hearing problems, and reviewing medications that increase fall risk. In many cases, fractures in older adults are more closely linked to falls than to bone density alone, meaning that fall prevention strategies may offer greater protection than aggressive drug therapy. Medical guidelines increasingly emphasize individualized fracture risk assessment rather than treating every abnormal scan result. For some high-risk individuals with previous fractures or very low bone density, medication may be appropriate and beneficial. However, for many adults over 70, a conservative approach that focuses on lifestyle measures, periodic reassessment, and careful monitoring is safer and more aligned with the goal of preserving independence and quality of life. After 70, bone health care should aim to support strength, mobility, and confidence, rather than relying solely on aggressive testing and treatments that may introduce new health problems.